Overactive bladder, or OAB, is a medical condition that makes you feel you need to urinate suddenly, often urgently, and sometimes involuntarily. The amount of urine that flows out may be a little or it may be a lot. Overactive bladder is not usually a serious threat to health, but it can be a symptom of some other serious problems. This video briefly lists and describes the main causes of overactive bladder. Many people believe that losing bladder control and other forms of incontinence happen naturally as you get older, but a problem of any kind anywhere in the urinary system can lead to an overactive bladder at any age. These causes commonly include the following: involuntary contractions. Bladder muscles contract involuntarily, triggering an urgent feeling that you need to urinate. Stress incontinence. This often happens to women who have given birth recently or have given birth many times. The muscles of the pelvic floor become weakened and urine flow is harder to control. Bladder infection. Bacteria can infiltrate the urinary system and multiply. This can result in a condition called cystitis, which is a painful bladder infection. Kidney infection. Bacteria migrate from the bladder up through the ureters and into the kidneys. This can be a dangerous situation if the kidney infection becomes chronic. A chronic kidney infection can lead to kidney failure, which may be life-threatening. Diabetes. Diabetes can certainly cause bladder control problems, including overactive bladder. Certain diseases and neurological conditions. Various medical disorders and conditions can cause OAB, including Parkinson's and multiple sclerosis. Overactive bladder is also more common after you've had a stroke. Outflow obstruction. This condition happens sometimes in men who have had prostate problems, when there is a blockage at the base of the bladder. Drugs. Certain medications and pharmaceuticals, including diuretics, can contribute to overactive bladder. Alcohol and caffeine. These may cause overactive bladder when used in excess. Both alcohol and caffeine act as a bladder stimulant and diuretic. OAB affects approximately 200 million people around the world. 3 times as many women suffer from overactive bladder as men. It can be embarrassing, and it's especially distressing to those who are experiencing it for the first time. To learn more about the symptoms and treatment options for overactive bladder syndrome, click on the links in the description section for this video.